Good morning. My name is Dominic Pote. I'm sorry I can't be with you today, but I've made this presentation so that I can share with you a little bit about my work and a recent Arts into Health project that I've been working on. First of all, a little background information about my work. I am a fine art photographer working for over 14 years with my own somewhat experimental approach to photography. As a child growing up, I enjoyed painting. Later on, I took an interest in photography and studied for a degree in 1997. It was then that I began to miss the expressiveness of painting and began to look for ways of using photography more expressively. I was searching for a way to show more than the appearance of a landscape, but how it really feels to be out there. So this was the starting point for the work I make up until this day. Using a homemade camera, using film, I make images as I move through a landscape and try to capture each place on film as a painter would do on canvas, only painting with light rather than paint. Over the years, I have made work for exhibitions and worked on various commissions for companies such as Barclays Bank, the British Council and P&O Cruises. In more recent years, I have been working increasingly in the healthcare sector. This has proven to be very rewarding, since it has placed the emphasis of my work very much on people. The places I now go out and photograph are the places shared with me by patients in hospitals, or by somebody at the end of their life, sharing with me a memory of a very special place. In 2013, I became part of the Collaborative Arts Project team for the St Giles Palliative Care Hospice. The St Giles Palliative Care Hospice lies in rural Staffordshire in the UK. In 2010, the existing day hospice was refurbished and the 27-bed Composite Centre, Annex, was designed by KKE Architects. I was commissioned to make artwork for the interior, not just creating artwork for the walls, but fully engaging the community of the hospice. The Arts into Health project at the St Giles Hospice took place from September 2013 until May 2014 and engaged everyone from within the hospice community in creative activity, including patients, staff, volunteers, carers and managers, led by a team of 2 arts workers, a poet, 2 visual artists and a documentary photographer. There were 3 key elements of the St Giles Arts into Health project that made it a success. Firstly, the creative workshops, which took place on a weekly basis. Secondly, the creation of a book as a focal point for the project. And thirdly, the artworks, an integral part of the workshops and the book, which resulted in large-scale environmental artworks for the interior walls of the hospice. The workshops were intended to improve people's feeling of well-being, and by using creative and artistic ways of working, to unlock memories and spark meaningful conversations with people. The sessions began as a series of writing and reminiscence sessions, the aim of which was to encourage those who both worked in and attended the hospice to share their life experiences, the people and the places and the things that mean something to them, those moments in time past that remain part of a vivid and ever-living present. Poetry was the medium chosen to embrace and capture these sessions, since it has a way of focusing attention on the small details of memory and experience and bring them up close into the here and now, making them new and clear and fresh. The visual artists were able to enrich this creative experience with aesthetic interpretations that both reflected and informed further creative dialogue. The conversations generated a positive, lively atmosphere in which people were forgetting their problems, as one of the group poems captures. It's like a big family gathering, relaxed and informal, meeting people, hearing laughter, socializing, feeling happy. Hearing stories brings back memories. It's lovely to recall fond thoughts, the happiness of shared stories, the comfort, the friendship, the help. It's a sanctuary where I forget my woes, and I'm just glad to be alive, where people are unfolding and all is well. Talking about positive memories of the past encourages healthy thought processes, rekindling positive emotions associated with the memory in the present moment. People feel a sense of belonging if they feel they're a part of a community, sharing a common culture and history. If people are reminded of their place in a community, as an inclusive member whose past and current participation in that community is recognised and respected, they have an increased sense of purpose and meaning in their life. It can be argued that in the healthcare environment, a sense of meaning is the most important side of Antonovsky's sense of coherence triangle.
A window in my world, peaceful and calm, caring, friendly, away from the familiar four walls. Being here opens a window in my world, taking time out, watching and reflecting. The tranquility quietens the soul. It's a paradox, an overwhelming experience. So glad I came. In my last moments, when I give my last gasp, I hope I'm here.
The book as a focus and a collaborative ongoing project. Patients at the hospice are generally used to one-off creative workshops that form part of their creative programme, but they were keen to point out that this was different. They felt that they were treated as equals in a collaborative project in which they played an important role, not simply as observers or participants, but actively as creators. The recollection of memories and the writing of poems had a positive impact of making sense and meaning of people's past and present, but the creation of the book created a meaningful process in itself. The book makes sense of people's lives, makes sense of the careers of all the staff, and makes sense of the mission of the hospice. The artworks. We often think of landscape as only physical, an environment separate from us, which we enter into, but in fact the very notion of landscape and our experience of it can only be viewed in terms of the human mind. As the historian Simon Sharma points out, before it can ever be the repose of the senses, landscape is the work of the mind. Its scenery is built up as much from strata of memory as from layers of rock. The photographic artworks created for the St. Giles project were essentially landscapes, but intended to capture the human landscape, the experience and our memories of landscapes. Each landscape artwork was made in direct response to a particular landscape remembered and described by a patient. The impressionistic style of my images was intended to capture the memory of each place, not just an image showing how each place looks today, but an impression of each place, embracing how it feels, or more importantly, how it felt for the person whose memory it represents. In this process, the restorative aspect of looking at nature images is underpinned by the recollection of positive memories. For the infirm or the elderly, whom it may be difficult to access for landscape, there is also the therapeutic benefit of talking about landscapes and places, opening up positive memory paths and encouraging healthy contemplation and discussion. From a salutogenic point of view of sense of coherence, it corresponds that the artwork in the healthcare setting should be first and foremost positive and uplifting, improving the sense of comprehensibility through its connection to place and linking the inside environment to the outside familiar world. Through its content, artworks have the potential to create meaningfulness, to offer distraction, but also to make positive emotional associations, and together these two elements can improve manageability, promoting coping strategies and a stronger sense of purpose and motivation. One of the themes we used for the workshops was meaningful places, a memory sharing session which encouraged people to talk about their memories of special places, but with a particular focus on landscapes. Prompted to think about particular landscapes, people soon began to recollect numerous positive memories of experiences in nature. In talking about places, people are able often unconsciously, to draw out meanings, which relate as much to themselves and their lives as they do to the landscape. In this respect, there is a deeper level of sense of meaning which can be drawn from these memory-sharing experiences, one which encourages an outward search for meaning, but in fact often results in an inward confirmation of meaning. In the following poem, the patient writes about their garden, but actually writes a contemplative piece of writing, reflecting upon their life.
Neglected, out of control. I had other things to do. My family in a time of crisis. I wanted it to be as it was. Now I'm finding it again, piece by piece. It's changing for the better. Maybe it happened for a good reason, because it's making me happy again.
The St Giles project was a success because it engaged people in a creative project in which they found themselves at the centre, their lives and their experiences. A project which was driven with an enthusiasm for life, and which aimed to celebrate the lives of people, the causes of their health, rather than the causes of their disease. After being involved in the creative sessions, one of the nurses at the hospice was inspired to write this following poem.
What is hospice care? It's the pushing together of two beds in the softly lit room of a couple, enabling them to hold each other in the silence of the night. It's helping a man to buy a special gold locket for his wife for Christmas, as he knew he would not be there to give it her himself. It's running with a child who has fled his mother's room when she died, and holding him in silence as his world pours out in uncontrollable sobs. It's the nurse's gentle touch of reassurance that I'm here for you, right now. I'm yours to listen. Of course there are tears, but there's also much laughter, strange as that may be. And yes, there is symptom control, support and guidance. But it's the little tiny actions that we give. That is hospice care to me.
Both sorrows and joys were shared and discussed during this project, and there were moments of laughter, as well as moments of reflective sadness and contemplation. But the overall ambience was a positive and jubilant one. Reflecting upon the creative sessions, one patient said, "Whilst we were working together in these sessions, I forgot I had cancer." This simple sentence, spoken from the heart, gave the whole project a profound sense of meaning. It was a testament to the importance of psychological well-being in the face of biological challenges.
A building like no other. It stands alone in an oasis of farmland, unpretentious, a red brick building with few windows. The magic begins as I enter. People are not coming here to die. They're sharing an opportunity to live. And this is what binds us. A dominant heart of interior warmth. The gift of life is a gift to be shared. From outside, it's a building that's like no other. Inside, it shares its life force with all who cross the threshold.